I'm Jen Gerhardt. I am the Vice President of all the community-based program, outpatient programs at High Point. So today we are going to be focusing in the morning on health and wellness coaching and connections to the community. So those are the two topics this morning. We're going to be doing some group exercises again by table. And I'm going to weave a little bit of the motivational interviewing piece into the health and wellness coaching today so that you guys can get your toes a little bit wet for have a little bit of a pre-motivational interviewing discussion, so you'll have some knowledge before you get the actual training next week. I know a lot of you may be familiar with MI, so certainly feel free to offer any experience you've had using MI if you have been, but I'll be weaving a little bit of that into today's discussion regarding health and wellness coaching, which is where we're going to start. We're going to take a break again at 10 and come back, and hopefully we'll finish up the health and wellness coaching after the break and move into connections to the community. One of the things that we're going to be doing with connections to the community is looking at each geographic area by table, which depending on which area you're going to be serving, you're going to be putting together your list of what your knowledge is of the resources in the area, because we have a big list, and then we'll be able to look at what you all might have brought to the table that we don't already have on the list, but it also just gets you thinking about what you already know and what maybe you don't know, so which is all fine. But that's going to be an important component when you're doing the care plan, is the knowledge of all the resources and being able to navigate and help your client navigate through what's going to be most helpful for him or her depending on what the person-centered treatment plan is. So I'm going to start with the policy, and then you're going to pick a partner and we're going to do an exercise. Okay, so this is the health and wellness coaching policy via the contract. So a lot of the language, I should say, from the policies, we had to use the language that was in the contract to get the policies to pass inspection by Mass Health. So some of it might be more technical than you would actually like, but we had to kind of use that language. So the purpose of health and wellness coaching is the coordinated, can you make that a little bit bigger or not? There we go. So the Coordinated Care Network, or CCN, will provide health and wellness coaching, which is an important component of every engaged enrollee's personal treatment plan. Annually with annual goals established. Health and wellness coaching is embedded in nearly all services provided and assessed annually with annual goals established. The care coordinator will provide health and wellness coaching activities as indicated in the person-centered treatment plan. So here we go. Health and wellness coaching activities may include, but are not limited to, providing health education, coaching, and symptom management to enable the engaged enrollee to be knowledgeable in the prevention and management of chronic medical conditions. So a lot of the pre-contemplation, so MI, motivational interviews, has 4 stages of change. The first stage is pre-contemplation. Pre-contemplation really means they're really not even contemplating making a change. So they're at a point where they're not ready, they haven't even begun to contemplate, so they're in pre-contemplation, meaning they may need a lot of education, about, their condition, whatever it might be, whether it's stress management, medical condition, whatever health and or wellness issue they may have in their life that they're not thinking of changing at this time. Really where you're going to maybe start is education. You might not, and they might even want to hear the education or read the education. So you really have to assess where they're at in the stage of change with whatever health and wellness issue they may be struggling with, from either a medical, and I can go into the different realms, because there is the 4 dimensions, if you want to call, for health and wellness. It's not just always medical, physical. There's medical, physical issues, but they're also mental, how are you kind of mentally refreshing and keeping your mind well. There is also the social emotional component, which is going and being your social relationships and your emotional well-being when it comes to your just community relationships and being not isolated, even though they may be an introverted person, still important to look at that social emotional component. And lastly, there's the spiritual realm. So kind of how are they taking care of themselves from either what their values and beliefs are. So there's health and wellness coaching that can go into multiple realms, and a lot of like the spiritual and physical can go together because some of the mindfulness activities that people do have that kind of spiritual and physical component to them, like yoga or Reiki and some of those techniques. So, but you do need to assess whether they're at pre-contemplation. Are they at contemplation, which means they're actually giving some thought to maybe I do want to kind of look at this issue and try to do something about it. They may not be in a real action mode, like, okay, I'm ready to conquer this. I'm just kind of thinking maybe I really should do something. Maybe there's a little thing that I can do that's going to make a difference. I'm not really ready to give this up or to change my eating or stop smoking or whatever the case, or start going to the gym, but I really need to think of what I can maybe do that I could live with, so kind of starting to think about making a change. The action stage really means I'm ready to make a change. I want to act. I really want to take steps, and I'm really committed. And then after that, if they're able to follow through with the action stage, there's a maintenance. So, a lot of times people make some strides on a goal when it comes to their health and wellness, and they achieve it, and then something happens in their life, or they fall back into kind of their regular, whatever the case might be, routine that they were in before, or stress, or some life situation, or stress, or whatever, and they fall back and they're not able to maintain. So then there's this maintenance stage that people might be even in maintenance when you meet them. Maybe they did give up smoking, or they're in remission from alcohol and they need to maintain that, but there's cravings and temptations and easy barriers that might get in the way of maintenance. So that's something that also needs to be assessed. So just keep that in mind when it comes to this whole activities that we're going to be doing. So educating the engaged enrollee on how to reduce high-risk behavior and health risk factors such as smoking, inadequate nutrition, and infrequent exercise. Assisting the engaged enrollee in establishing links to health promotion activities such as smoking cessation and weight loss. And assisting the engaged enrollee in setting health and wellness goals as part of the engaged enrollee's person-centered treatment plan. There's bugs flying on the screen, which is really annoying. Do you want to scroll up? So the procedure, keep going. So the care coordinator is going to work with the engaged enrollee to identify health and wellness goals that will be implemented in the person-centered treatment plan. Will attend trainings including but not limited to nutrition, exercise, medication management, smoking cessation, weight management, symptom management, peer and recovery support, which is serious mental illness and substance use disorder support and brain injury survivors as required, to effectively coach the engaged enrollee in reaching their health and wellness goals. So there's a lot of webinars and trainings out there that have to do with health and wellness that we'll be weaving in to all the ongoing training you're going to be getting as a care coordinator. We'll provide motivational interviewing techniques with the engaged enrollee to encourage positive change to reach their health and wellness goals. And will affirm good decisions made by the engaged enrollees and refer them on where to go to assist toward completion of their goals. The registered nurse, so the RN, will provide medication reconciliation to ensure accuracy and safety with the medications prescribed, and will work with the care team to coordinate medical services that may be necessary to reach their health goals. The clinical care manager will review all person-centered treatment plans to ensure that there are health and wellness coaching activities, and the program director will oversee the process and will do appropriate chart auditing to ensure accurate documentation within the enrollee record. So that's pretty straightforward, right? Does anybody have any questions about the policy, how it's written? Okay. So we're going to do some exercises with health and wellness, and remember a lot of it has to do with lifestyle and making lifestyle changes, but I am going to ask you to pick a partner, and one of you is going to be the care coordinator, the other is going to be yourself. And what the care coordinator is going to help the other person do is establish some health and wellness goals. So you can either make it up or you can use I encourage you to think of your own self and to set some one or two, a long-term, a couple short-term, some tasks, and barriers. So do people remember what the person-centered treatment plan looked like? So they have that top section about yourself. You can forget that. Just really talk to the person about what kind of lifestyle changes do you want to make, what are some what is one long term, even if you just do one, and a couple short term tasks and barriers and challenges. And then you're going to switch. Okay, so hopefully this will actually give you some motivation to maybe look at, we all have different things that we want to do, but also we'll put you in the position of having to think like you would be having the consumer think about things that might be really hard for them to change. I would also encourage you to try to identify with the care coordinator, help the other person identify what stage of change they're in with that particular goal. So it might be something that you want to maintain. It might be something that you're not really ready to change. You think you should, but you're not really ready, or you're ready to start thinking about. So try to use some of those MI lingo in, and just I'm not going to ask you to share, but if any of you want to share, that would be fine. So this is something that I've always been made to do when I'm in a MI training. They always ask you to kind of use yourself and say what is something that, what stage of change are you at with something, a goal that you have. So that's kind of where we're coming from with health and wellness. So pick a partner and decide who wants to be the interviewer, the care coordinator, and who wants to be the, you. Or you can make it up if you want. If you want to be a pretend client, you can definitely do that. But come up with a long-term, a couple short-term goals, and some tasks and challenges, and then we're going to switch. Okay? Everybody understand what to do?
Those are perfect.
Yeah, I have a famous one too, but I cannot find it.
Would I do that? Yeah, that we could see.
Oh, and just remember there's different realms of health and wellness. It doesn't always just have to be related to medical or physical. It can be related to spiritual, social. So we're going to come back as a group. So I guess I just want to talk a little bit about how did it feel to work on this as the care coordinator? How did it feel to be the care coordinator in working on this particular exercise?
It was good because it focused on something positive, and my partner was bringing something positive that she was already working on and making some progress. We were able to talk about that and really focus on where she wanted to head with it.
Was it helpful to talk about it as as you, if you were you? How did that feel? Did it feel did it feel burdensome? Did it feel like you were revisiting something that you wanted to revisit and discussing the stage of change? I'm just wondering how that felt as you worked on this as the consumer.
It kind of felt natural.
Say it again?
It kind of just felt natural.
Natural?
Like it wasn't like something that was too personal, like you know what I mean? It's just basic conversation that you would normally have about a goal.
Great. What about the rest of you?
Well, I think whatever we brought up, we were already contemplative about it, that's why, so it was kind of easy to talk about what our goals are, because it's something we've already been thinking about about and wanna achieve for us.
Did anybody, yeah,
I thought it was good because I kind of got a different, I guess, different outlook of how to achieve the goal. So I think that kind of helped. That helped for me, kind of looking at myself and really thinking about, the goal that I want to get. And she definitely helped with trying to help me achieve that. So I felt it was a good, positive exercise.
were you able to break it down into steps, like help the, person, because I think that that's something that we're gonna really need to work on with our clients, is really breaking it down into manageable steps that they feel like are doable and realistic, and we talked about that yesterday. So how did that go? Was that something that you were able to get, as the care coordinator, kind of get to that specific level of detail? Yes?
It makes it easier, I think, to have, to go over you have a long-term goal, but that's overwhelming for anybody, me or them especially, because they have for a lot of them, they have limited resources or limited ability to connect with people, whatever it is, and
Right.
but for me, to break it down into shorter goals, the short-term goals made it seem a lot more doable than, okay, I wanna do this and that's it,
Right.
but just do the steps, and that was one of the things, and then to talk about the barriers that I know I have, or
Sure.
or having them pointed out, because a lot of times you don't even realize it could be a barrier,
Right.
so.
Yes, good. Did anybody get somebody that was in a pre-contemplation state with whatever goal they had? You guys didn't choose something that you weren't ready to actually do at this time? Nobody had a pre-contemplation person? That's the hardest, obviously, when somebody is in that stage. So be prepared that you guys are, obviously the clients that we get are faced with huge amount of more challenges, and that's why I do bring up lifestyle changes. And if you think about a lifestyle change that you made and how hard that might have been to get to from point A to point B, if we have trouble, imagine how our clients are feeling, because they've got so many more, for the most part, they have so many more issues in their serious mental, because they all have serious mental illness and or substance use or a combination. So when you have that, when you're facing that, to make lifestyle changes can be that much more difficult, because a lot of these folks, their coping strategies are not good for them, but they're coping strategies. So we need to acknowledge if a coping strategy for them is they don't like being around people, and it's easier for them to cope when they're by themselves and isolated. They might have social phobia, they might have, fear of going out. I know I had a woman who, health and wellness was a huge area for her, because she was living in her house by herself. Her husband had passed away. She did not like being around people at all. She was so isolated. She also had medical issues, so she couldn't get out of the house and couldn't get around her house very well. So she laid on her couch most of the time. She has a huge TV and watched television, and that's what she liked to do. And she also listened to music in her house. But she did have some people coming in and out, bringing her Meals on Wheels and things like that, 'cause she couldn't go grocery shopping, she couldn't drive, but she did not want to do anything. She wasn't ready to. She also was a smoker, so she wasn't taking good care of her physical health. That her eating was on and off, like the Meals on Wheels sometimes, but she would get things at the grocery store. She wasn't really a good cook for herself. So there were the huge challenges when it came to, and she wasn't ready. She didn't want to go out and do things. She didn't want to go, there was a senior center right down the street. She didn't want to get out and try to walk, even to get the mail, and we talked about that yesterday. So, you're going to find huge challenges and things. I was like, you need to do that. I was in this, you need to get out of the house. I brought her a lawn chair one day, and she didn't want to use it. And so, there's just, like I said, huge challenges that you're going to face when you, and they're going to be a lot of times in a pre-contemplation state of where their chronic medical conditions and or their health and wellness might be being compromised. So But that was good exercise. So we are going to do another exercise as a table. So I'm going to give each table 2 diagnoses. And what you're going to do as a table is come up with, you can decide if they're in pre-contemplation, contemplation, action, or maintenance with whatever. You can make that decision on your own. Challenge yourself to choose one of those stages of change with whatever diagnosis you want to choose. You might choose their depression or their diabetes or both and see where they're at. So I'm going to go around and give you what your diagnoses are by table, and you're going to come up with 5 suggestions of things that you might be working with them dependent on the stage of change that they're going to be in. So are you going to choose pre-contemplation? So they might have diabetes and they're really not ready to make a lifestyle change with their nutrition and their eating, you know. And with their depression, they might be contemplating, you know, getting out of the house more and doing things to help them feel happier. So you can decide which stage of change, unless you would prefer me to prescribe the stage of change. Which would you prefer? Do you want me to do it? Okay. Then give me 1 second. I am going to put your point person on the spot because we are filming this. So I would like whoever is going to be the note taker and talker at your table to come up where I am and present what your situation was, what your diagnoses were with your client, and what your table came up with as some goals and suggestions for health and wellness. And also the stage of change that each of the, that the client was at with the diagnostic issues going on. So who would like to start?
I guess that would be us.
Would you guys like to start? So you're gonna need to come up.
Oh, you want me to come with you?
Yeah, you need to kind of go over here. There you go.
Our first diagnosis was PTSD from domestic violence. And she was in the pre-contemplation stage. So her long-term goal that we kind of came up with was to get into counseling. Her short-term was to identify social supports, utilize her coping skills. The suggestions were to educate her on PTSD as well as domestic violence, provide materials for both, and to possibly teach her some grounding, like social skills for to reground herself. Our other person had an opioid addiction and they were in contemplation. Their long-term goal was to remain clean. Their short-term goal was to attend NA meeting daily and to speak with a recovery coach as needed. The suggestions were just different locations for the NA groups and where the times and everything. Brochures on different community supports and referrals out to different agencies for a recovery coach. That's it.
Thank you. So you want to remember to be thinking about the health and wellness too component. So just that was great. That was broken down into small steps for each particular one. The other thing, and I don't know if I explained this correctly, but this is one person with both of these diagnoses. But that's fine that you decided it was. Probably my fault, but I'm not sure if everybody else got that. But so that's okay. So that's okay.
She's addicted.
So let's start with this table then. Who did you guys in the corner here? Who was your? Nope, you have to come up here by the camera.
So our first diagnosis was bipolar and pre-contemplating taking medications. So the long-term goal would be being able to identify a medication that they are willing to take. Because sometimes they do kind of pick and choose different meds. And, you know, even though it may not be optimal, that medication that they're willing to take, it's something. So somebody suggested sign a release to communicate with the psych provider, finding out if they are hooked up with a therapist or, you know, a psychiatrist. Sometimes, most of the time, they're not. So it's, you know, trying to convince them to go see somebody. Well, not convince them, but offer them. Tell them what the benefits of that would be. And finding out really what the reasoning is behind the non-compliance and addressing it. Maybe it is because of a medication, the way it makes them feel. Could be something you're not even aware of. You know, their thinking is different than ours, and it's a little bit distorted. So it could be a hallucination that they're having. We don't know, so it's really finding that out. And also find out about why they're non-compliant. Is it because they're having trouble managing their medications? Maybe they need somebody to go in there and manage their meds, a visiting nurse. Maybe there's a family member that's available to help organize their medications. And just educating about medications, what the medications do, and the long-term effects of not taking medications on your brain. I mean, it's not good. And just, you know, what I was saying is a lot of people don't take medications because they don't really understand how it, you know, with an example would be like diabetes. When you have elevated blood sugars, it's like having shards of glass in your veins. And when I tell my patients this, they're like, it is? And so it's making it personal to the patient so that they can actually, you know, what is the benefit for them to take it? It's not because it's just good for them, it's, well, how is it going to affect my life? So that was bipolar, and then we did ETOH, they're contemplating stopping drinking. So you know, first thing is validating, listening to them without judgment, because they already have a lot of shame. They've done, you know, when you're drinking, you don't make the best decisions. So just listening to them without judgment and maybe saying, you know, hey, I'm not perfect either. You know, I don't expect you to be perfect. Maybe helping them identify some meetings that they would feel comfortable going to. There's a lot of different AA meetings, and they're not for everybody. You know, there's always that one that you feel more comfortable in. And maybe helping them to hook up with an AA sponsor, somebody that can kind of check in with them periodically and offer that support. Identify triggers for drinking. Why are they drinking? You know, it could be, you know, maybe they're hearing voices. Maybe we don't know. So identifying why is it that they are drinking and addressing what those triggers are. And replacing, replacing an activity for the drinking. I mean, easier said than done, but helping a person identify what is it something that helps you when, you know, usually, you know, what precedes drinking is anxiety. It's something that happened. They don't know how to deal with it. So it's a way that they cope and self-medicate. So what can we offer you that's healthy, that would help you? Maybe it's a clonidine or a medication that's going to help them, you know, feel better, and that's communicating with a psychiatrist. Maybe it's not being around certain people, you know. And that's our last point is, you know, when you're when you're not drinking, you know, I'm not going to hang out with my girlfriend that drinks a case of beer. You know, you're going to surround yourself with people that have the same goals so that you can achieve them.
Thank you. That was great, identifying triggers and what are some healthy things that they can do instead of drink when they have the stress or the anxiety or whatever. That was great. Okay, this table.
Hi, so we have,
Just stand over here a little bit more, sorry.
okay. So we have someone who has anxiety. She was abused as a child. She has trouble going outside. She's hypervigilant. She has asthma, but she's engaged with her providers about her asthma. And she's on the contemplation stage. So our first intervention or goal with her would be to start the discussion regarding her addressing her mental health issues and how that will bring positive changes in her life. The second would be kind of discussing with her about connecting her with a psychiatrist and an individual therapist, and if she's having trouble going outside the home, the possibility of having a in-home therapist for her. The second would be discussing some support networks, whether it's family or friends, that can assist her with taking short walks outside. A third would be discussing any community resources that may be available for her, whether it's a day program or a peer support group, just to help her socialize and getting outside the house. Then addressing any coping skills to help her reduce the anxiety symptoms. Then creating a symptom management plan, just getting in touch with her providers and seeing what kind of triggers she has and what she can do to reduce those symptoms. And then I guess encourage her to continue seeing her PCP regarding her asthma. And that's it.
That was great. Very good. And back table?
So our individual was a male who was diagnosed with schizophrenia and in the action stage, so willing and interested in taking his medication and feeling like treatment was something that was worthwhile for him to be engaged with. And he also has heart disease, is a smoker, and was in the pre-contemplation stage in terms of quitting smoking. So in the conversation from the schizophrenia side of things, we talked about just connecting with providers, so the psychiatrist and the therapist, and staying in contact with them, seeing if there were any kind of additional things that we could be supporting the client with, and also talked about maybe putting into play a support group if there's a group for individuals that are struggling with health issues as well as schizophrenia, or at least just the mental health side of things. The biggest challenge in our conversation was definitely around the pre-contemplation stage and the health issues and the tobacco use, and kind of how do we get somebody to be motivated to change when they don't want to change. So some of the strategies were just providing him with some information about strategies to quit smoking, impacts on health, but then working with him to talk about his strengths and what he is willing to work towards. So whether it was go outside and take a walk for 5 minutes before smoking a cigarette, and helping to kind of build a certain level of confidence of, okay, you can go 5 minutes of delaying that urge and craving, can you go 10 minutes? And building a level of confidence from there versus just trying to tell him that he needs to change. And again, coordinating with another area was like identifying or kind of like coaching him towards change in that area. So again, connecting with the therapist to see what progress is being made, and then how to use that into kind of further supporting any changes that he might want to implement, or other areas that maybe he's not willing to quit smoking, but he's willing to change how he's eating, or other decisions that might affect his heart disease.
Great. Very good. You guys are really getting this. That's awesome. And I think that was really good to break it down into measurable steps, like really small baby steps, like for 5 minutes, can you go out and walk? And then maybe up it to 10 minutes. And so those are the kinds of really small tasks you want to be able to break down, because, as we talked about yesterday, the smaller, the more manageable, the more realistic for the person. So that was great. Very last table.
Just kiss yourself with that.
Our client is a female adult with depression, diabetes, obesity. She's in the contemplation stage. The challenges are finding the right medication for her mental health. So that would be going to the key contact would be the PCP, and talking with her and the doctor to see what would work. To us, we felt that she was more like a couch potato and wasn't able to go out. Maybe working one-on-one and the referrals with the PCP. Also, the barriers would be asking her the barriers. If there's support, family support, community resources, if she knew of any, asking her challenges and helping her with it. And absolutely talking with her about eating disorder support groups. Basically trying to find the key component to, working with her depression and making sure that her diabetes is stabilized along with the obesity. That's what we came up with.
That's great. A lot of times with depression, people have eating issues, so they're maybe obese because they're eating as a strategy for dealing with their depression, and yet they're obese and they have diabetes. So how do you that was that group's challenge. So, but that was really great. Thank you all, and pretty good timing because we're going to take a break. And it's 10 o'clock, so we'll come back at 10:15 and we'll do connections to the community. This is where you're going to be active and exercised. So once we get through the policy, and then I'll give you time. Okay. I wonder how the shower went.
I know. I know. I'm gonna charge my computer for 15.
Yeah, it goes quick here. Oh. But here, you can charge. Oh. That's why I asked. That's sorry. I know. I have Alan at 1, and we're going to talk about that. Keys, because Kim, I feel like Kim is doing really well. It goes to show, like, he's thought Lori was as good as she was. It sounds like Kim's doing a lot better and is able to manage a lot of things, whereas Lori got overwhelmed. So Kim may be able to handle doing all the referrals and stuff like that.
Yeah, I was just more concerned that I don't want to, because I just didn't want to get behind on it.
No, I don't want you to.
Yeah.
It comes down to, can Kim do this? All of it. We are going to spend the next segment on connections to the community and identifying community resources. And we will be doing an exercise, and I will be showing you guys what the first cohort came up with, a great list by geographic area and by kind of identified need. So we'll be doing the same and comparing our lists and putting them all together in one big list, along with what we already have established back at our own agencies. So we're going to go through the policy, and I should let you know this afternoon Bansi is actually presenting we talked a lot about long-term support services, that LTSS acronym. they're gonna be doing a lot on the LTSS services this afternoon, so, just so you know, that will fill in that particular gap that we've been talking about long-term. Like, part of your responsibility is if they need those LTSS services, that you're identifying that and making referrals for those services. So they'll be doing a lot of, training with that particular population that needs LTSS this afternoon. So if you want to go up to so this is, the name of this policy is Connection to Community Support and Social Services Policy. So we'll be just reading through the policy. The Coordinated Care Network, or CCN, will work to develop and maintain collaborative relationships with community-based organizations in the service areas and state agencies. Such agencies and organizations will include, but are not limited to, the Executive Office of Elder Affairs, which is EOEA, the Department of Children and Families, which is DCF, the Department of Mental Health, which is DMH, the Department of Developmental Services, which is DDS, the Department of Public Health, DPH, the Massachusetts Rehabilitation Commission, which is MCR, and the Massachusetts Commission for the Deaf and Hard of Hearing, and the Massachusetts Commission for the Blind. CCN will develop and maintain collaborative relationships with and have knowledge of the services and specialties offered by the following specific types of providers: behavioral health and long-term services and supports providers, social and flexible service providers, primary care physicians, and other specialists working with engaged enrollees. The procedure: the care coordinator will assess each engaged enrollee for community-based social and flexible service needs using social services assessment tools, that's embedded in the comprehensive assessment. Will identify community-based social and flexible services and resources that will support health and well-being of each engaged enrollee based on the outcome of the assessment. Will document results of the social services assessment and include a list of the community and social services resources in the engaged enrollee's person-centered treatment plan. So basically that means, you'll identify what their needs are in the assessment, and that will get hooking them up with whatever services and resources will be documented in the person-centered treatment plan, which ones you determine that they will be using. And then we'll assist each engaged enrollee in accessing community-based and social services and resources in their geographic area. We'll follow up and ensure the engaged enrollee is obtaining community-based social and flexible services as indicated by the engaged enrollee's person-centered treatment plan. We'll have releases of information signed by the enrollee or authorized representative to communicate with agencies and or organizations the engaged enrollee is involved with in order to coordinate care. We'll coordinate with any other case management service an engaged enrollee receives to ensure that supports supplement but do not duplicate other services provided. So that's an important piece. There's other case management services out there that are different from care coordination. They enhance care coordination. And one of those services is Community Support Program, which is the CSP program. A lot of you may know and have CSP in your own internal organization. CSP workers do the same thing in some ways that you guys are going to be doing, but they do it to a more specific extent, like they bring them to their appointments when needed. They provide transportation. So if you have a client that really doesn't have transportation and isn't going to follow through with a lot of important appointments, and it's going to take time to figure out what their transportation plan is going to be, a referral for CSP could be a really important referral to at least get that client to have a CSP worker that actually does some more specific things that you guys aren't going to have the time to do with your particular caseload. So that's an example where, if they had transportation and CSP was just, you were just referring for CSP because you wanted extra support, you want to make sure it's not duplicating what you're doing. You want to make sure it's enhancing what you're doing, that there is a need that you're not able to fill for that person that CSP could fill. So that's just an important piece to remember. And then recovery coach is obviously something that isn't duplicating what you guys are doing. It's a more specific service that's related to a peer-to-peer support for their substance use. Okay, so where did I leave off? 8. We'll coordinate with each engaged and release ACCS providers as follows. And that's more of a BAMSI, just so you know, BAMSI has the ACCS. It used to be CBFS and now it's ACCS. It's basically the population that has more developmental delays and more of those needs. But BAMSI's going to be getting all the ACCS clients in Brockton, yeah. So we'll coordinate with each engaged and release ACCS providers as follows. Inform the engaged and release ACCS provider of all the routine and specialty medical care, including identifiable symptoms that may require routine monitoring. Coordinate with the engaged and release ACCS provider to develop a crisis plan and prevent the use of emergency departments, hospitalizations, and criminal justice involvement, and provide follow-up if these events occur. And coordinate the engaged and release ACCS provider regarding activities for improving the engaged and release health and wellness, and to allow ACCS providers to assist and reinforce their health and wellness goals. Again, the ACCS is a particular population that BAMSI is going to be covering primarily. The clinical care manager will recommend flexible services identified by need in the social service assessment to the engaged and release ACO. Will report outcomes of social service assessments in a form which could be shared to EOHHS at their request. And will monitor engaged and release needs and ensure appropriate referrals are followed through with for community-based and social services. So they're going to basically be overseeing that you're referring for all the needed areas and making suggestions and making sure that that we have the ability to report outcomes of the social service assessment to EOHHS at their request. And then the program director will oversee the process and will do appropriate chart auditing to ensure accurate documentation within the enrollee record. So, any questions? This policy is really about making sure that you're working with your enrollees to hook them up with as many community and social services supports that they need based on their identified areas of need. So looking at their, you know, all of their needs that you do on the comprehensive assessment and what the goals are. So if you have goals around housing, or you have goals around socialization, you have goals around medical issues, you need to be sure that you're hooking them up with whatever community-based supports are going to be best as resources to help them achieve their goals. You're not going to be able to do everything with them, obviously. You need to make sure that they're utilizing those resources in the community. So any questions about that policy? Okay, so we are going to be doing an exercise by table 2 again. So this is what we did with the last cohort, so we're going to be doing the same thing with you guys. So Amanda is going to be pulling up. Okay, so these are all the different areas so that you're going to be taking your table, and I'm going to give you a geographic region to cover. And you're going to come up with, in that area, what knowledge do you have of social, you know, resources for socialization, professional resources. What are the professional resources in your area? And professional means, you know, professional therapists, psychiatrists, professional medical professionals. So that would cover, you know, the professional resources that you're going to be referring. So housing, addiction, so separating the professional mental health from the addictions would be the substance use, okay? Vocational and financial. So do you guys understand you'll need a note taker? So you guys are going to have New Bedford, obviously.
Sure.
Okay. Do you guys cover Fall River at all as well? Not so much. Not so much.
Not as much.
Not as much. Okay. So we'll stick with New Bedford for you guys. You guys are. Where are you? I'm making notes. Well, that's what I think.
Oh, I mean, personal.
Right, but I'll make a list. We'll bring it back to the office.
Yeah.
We'll bring it back to you like a photocopy.
My handwriting's pretty neat.
And we will be combining the lists and handing them out to you guys hopefully next week. So, gonna get a lot of handouts next week. And Amanda's gonna be doing a lot of copying, so. Okay, so let's start with, is Brockton the one you put up top? or-
Yeah.
So we're gonna start with the Brockton groups then. So, first table on the corner here, whoever took notes, if you would just mind going through what you came up with in each of these categories. And just kind of speak slow, because she's gonna be typing, so.
Okay. So for the first, social would be BAMSI ADT day program. Then we have BAMSI Clubhouse. The YMCA. And Salvation Army. And then for professional, we have the Brockton Multi-Service Center, Signature Healthcare, Brockton Neighborhood Healthcare,
Just wait a
Health
minute.
Center,
Okay.
and then for housing, we have DTA, Catholic Charities, Father Bills, and then for vocational, we have also DTA, Mass Rehab, and again, Father Bills. Addiction, we have Salvation Army. We have Brockton Comprehensive Treatment Center. And then, sorry, and then for the last category, we have for financial, we have DTA.
Can I just add High Point to that? Under addiction, thanks. Okay, financial,
DTA.
is that it?
Yep.
Okay, so can you guys add to whatever they didn't? So if you want to start with social and go down if you had other things.
Sure. So for social, we had South Bay Day Treatment Center, the BAMSI Recovery Learning Center, Haitian Day Program, and Day Habilitation.
What was the last one?
The Day Habilitation at BAMSI.
Dayhab at BAMSI,
Oh.
BAMSI Dayhab.
And then for professional, let's see, BAMSI or Whitman Counseling, South Bay Community Services Clinic, Northeast Health Services, Westside Behavioral Health, Star Psychiatric, and these are all mental health providers. Luminosity in Stoughton,
How do you spell that?
LUMINOSITY. And Abelard Psychotherapy, ABELAARD. And then the Brockton VA. I don't know if that's up there.
And can I just put High Point home-based counseling and High Point Hospital.
For housing, we have the same Brockton Housing Authority, Mainstream Shelter. Brockton Housing Authority. And then vocational mass rehab. And then addiction, we also put Gosnell outpatient clinic. High Point, Bay State Suboxone treatment. Teen Challenge. And the BAMZ Project COPE Women's Group. COPE, COP, Project COPE. Yeah, financials, also detailed.
Oh, okay.
Anything else under addictions?
That was all we had. Oh, right. Yeah, Andrew House.
Financial, we have PA and we have self-help for utilities, self-help. You can also put churches. Challenge help.
And I think Teen Challenge helps with utilities, she was saying.
Okay.
Is that it? Great. Okay, we can go down to the Quincy table.
Okay, for social, we have Quincy Family Resource Center. We also have Department of Mental Health. Savannah Center.
How you spell that?
Sure.
Wait. DEAV. Okay.
Yep, ANNA.
Okay.
South Shore Mental Health. Learn to Cope. Head Injury Community Services. And for professional, we have Quincy Career Center. Okay, Quincy College also assists with that. Mass Rehab. And what's the next one? Sorry, can you scroll down? Okay, and for housing, also Quincy Family Resource Center. Harvard Housing Law Clinic, which is based in Cambridge, but they go to Quincy as well.
Harvard Housing Law Clinic?
Yes. And QCAP.
Just the letter Q and then CAP. Father Bill's, Quincy Housing Authority.
And for vocational, we have Quincy Career Center. And the next one for addictions, we have New Wave Recovery. Bay State Community Services. AdCare. Manic Community Health Center. Allied. Mass Rehab. And for financial, we have financial planning for seniors. Also QCAP. And that's it.
Okay.
For addictions, learn to post meetings in Quincy. And under, back at the top, first, there's a YMCA.
Great, thank you. Plymouth, and if you have any Taunton, we'll do Plymouth first though.
Okay, Plymouth, for social, we have Plymouth Council on Aging. Harbor Community Health Center. South Shore Community Action, and like group, you know, just in general, some of the groups that are around, like maybe a walking group or I don't have any specific ones, but oh, the YMCA, sorry, I missed that one. So that would be something that they would probably have access to. For professional, we have Harbor Counseling, Plymouth Center for Behavioral Health, or just counseling. Domestic violence, at High, is it High? No, domestic violence at High Point, well, obviously High Point would be in there. Anyway, sorry, almost forgot about that. We also have, Healthcare, Financial Inc., and South Shore Women's Center.
Isn't that the domestic violence?
Oh, is that the domestic violence?
Yeah.
Oh, okay. Sorry.
But that's the name of it, so.
All right.
So you can.
I also had, found Bayview Associates Counseling and Integrated Counseling Centers.
But that's what.
Beth Israel Deaconess. Bereavement and eating disorder counseling, but where do they do that? At Beth Israel, oh, sorry.
And also they do it in High Point,
Oh, they do. Well, we got High Point.
I know how to do that.
Under housing, we have the Kingston Housing Authority, Plymouth Area Coalition, Plymouth Housing Authority. Housing Solutions.
Plymouth Housing Authority.
Yeah. Under addiction, obviously, High Point.
What about
Excuse me,
Oh, do you
vocational?
have more on that one?
in housing, in Plymouth,
We
we
got
have two.
vocation back
One is
inside.
a federal program, what you have there, and we have one housing authority that is private organization, and that covers Plymouth, Carver, Kingston.
What is
And
that?
you are,
I'm
the
sorry.
name of the housing is called Housing Solution. It's
Yeah, we
another
have Housing Solutions.
Yeah, we got it.
No. Oh, you
We
have
have
it.
it.
I got it,
Yep.
yeah, she wrote it, so, I had the things backwards on this
Okay.
paper, but vocational, Plymouth Career Center, Mass Rehab, that was, is there any other vocation besides what you put? Have another vocation? Oh, Quincy College does vocation.
Well, that's under Quincy.
Yeah, that would be under Quincy though. They did Quincy over there. All right, so, is there a walk-in career center at, oh, we wrote it, Plymouth Career Center. Sorry. Trying to read this. Under addiction, we have High Point. Clean Slate Addiction Treatment Center. Crossroads. And Anchor House. Under financial, we have, oh, okay, well, go ahead.
I'm sorry.
I'm reading off.
Recovery Spectrum Stone Clinic, that's all right. Boswell G1, Potomac, Emerson House for Women.
Wait,
So that's not down the
I think,
thing, we're
but
not,
that's, you're going to the.
no,
No, okay.
Duffy's doing it. All right, hold on, guys. She's trying to type herself. For addiction, is that it for addiction?
And the Plymouth Recovery. And then, can we go as far as Weymouth in Plymouth? Like,
The
for
Quincy
messaging?
area covers
Oh, okay.
Weymouth, but,
All right,
okay,
all right.
so financial,
Under financial, we have Department of Transitional Assistance. Any of the food pantries, which is, you know.
yeah, that was one thing some people didn't bring up was food stamps, pantry.
There's a lot more now, I know.
Yeah.
St. Vincent de Paul is great for financial in almost every
St.
Catholic
Vincent's?
church.
The churches.
St. Vincent de Paul's,
St. Vincent de
when you
Paul.
go through a Catholic church, that's who you call to get
Yep,
the financial help. Try that. Share, give thanks.
share,
Social Security, SS, Social Security and,
mhm.
we said DTFA, right? Yeah. Okay. Anybody else have any other ones on that?
Energy assistance,
Oh, fuel assistance too, yeah.
program,
And,
and it's a program they call it food and cash assistance.
food and cash assistance.
that's
That's the
DT.
umbrella under the.
That is under
DTA?
DTA.
Oh, yeah,
It's
so,
a different program under DTA.
yeah, they go to DTA basically, they'll tell them that stuff, so. Do you wanna read?
There's also South Shore
Oh, South Shore Housing Authority, right.
and Community Action.
All right.
Great, and did Taunton come up with anything you wanna throw in there?
For social ed, Department of Youth Services,
What is it?
Can you,
Department of Youth Services, Teen Challenge, Community Care Services, Professional. I had South Bay Community Services and CCBC. And then for housing, I had.
You can put High Point too, under professional, home-based service.
I had Taunton Housing Authority. And Father Bills in Mainspring. For vocational, I had Mass Rehab. And Taunton Career Center. And addiction, I had High Point. AA and NA meetings. Arbor Fuller. North Cottage. And for financial, I had food pantries, Taunton DTA, St. Vincent de Paul.
Great, thank you. And finally, we have New Bedford.
Alright, what is that? Social? For social, we have Catholic Social Services, Meals on Wheels, Soup Kitchen, MO Life, which does food pantries.
MO?
M, capital M, capital O, and then it's Life.
Okay.
Council on Aging. Yeah. We had the day programs. There's like a lot to us.
Yeah.
Coastline elderly. No, that was in professional. We put that. Oh no, it was there. Sorry.
No, we don't have that one. She just-
Coastline. Yeah, coastline services.
Elderly services.
Community care services. That was it for social. Professionals, the long one. Of course, we had CFS first. Community counseling, Bristol County. People Incorporated, New Bedford Health Center. Oh, sorry.
Just people in.
I forgot you were typing.
People Inc.
People Inc., yeah. The Women's Center. Arbor Mental Health. Seven Hills. Family Resource Center. The Veterans Transition. Kennedy Donovan Center. Gandara, Gandara.
Oh, she needs you to spell it again.
Oh,
ENDRA.
Gandara. And Fellowship Health Resources.
You can also put High Point home-based.
Oh yeah, High Point. Sorry.
That's separate.
I always
from the-
forget, but I always add you
We
guys
do
in.
home-based services for adults that, it's not just a substance use, it's any mental health. We can do counseling in the home.
Oh, and the May Institute, sorry.
For professional.
Housing, we have the New Bedford Housing Authority. Dartmouth Housing Authority. And then Fairhaven Housing Authority. Should our list of shelters go in that?
Mm-hmm.
Okay.
Yeah.
So Donovan House, Harbor House, YWCA, the Sister Rose House, the Louis Martinez Homeless Shelter,
Is it Martinez?
Martinez, M-A-R-T-I-N-E-Z.
Homeless.
The Grace House. And Packer.
Great.
Vocational services, we have Packer. Youth Build. New Directions. The New Rapid Employment Office. SIR Jobs.
What's that?
SCR.
Sir,
And then
Jobs.
just jobs. Okay.
Mass Rehab. MO Life. I think that's all we had for vocational. What's next?
Addiction.
Addiction. High Point. Stepping Stone. Packer. Monarch. The Donovan House. CTC Addiction Services. Clean Slate. Gifford Street Wellness Center. And Reflections. We have one more under social, it's Meeting Street, sorry.
Meeting Street?
Yeah. We got what, financial?
Financial.
Financial, we have the DTA, WIC, Home Base, Raft, PACE for childcare and fuel assistance, My Brother's Keeper, Salvation Army, and that's it for financial.
Great, so now we're just gonna take a quick look at what we came up with. There's a lot of overlap, I remember that. So if you wanna just go to cohort 1. And we got a Quincy list because we didn't do any Quincy in the first round. Because I don't think there was anybody from Bay State here, that's why.
Just give me a second.
So for Brockton, and again, we're gonna kind of be combining, but as you can see, there's a lot of overlap. We came up with for social, a couple weeks ago, Massasoit Community College. I don't think that was on the list. Day program, BAMSI clubhouses, South Bay partial hospitalization, Brockton Adult Day Center, which is nurses or elderly services. Quest House, library groups, multicultural building, churches, local recreation events, YMCA, the ARC, and Bragley. And for professional, we came up with DMH, Whitman Counseling, I think is that all care or ad care?
All care.
All care, PCA Home, written correctly. All Care PCA Home Health Aid Services, Foster Care VNA Services, Legal Assistance, Free Legal Advice, Youth Works, Job Fairs, and Technical Schools. Under housing, we came up with BHA, DMH vouchers, respite, father bills, family shelter in Stoughton, Ruth House, and Raft program. There's a couple new ones in there. Vocational was Mass Rehab, BAMSI, MCC, Brockton Adult Learning Center, Catholic Charities, Career Works, and the GED program at Massasoit Community College. And for the addictions, came up with High Point, NAAA, Father Bills, various support groups, Teen Challenge, and South Bay. Financial was Social Security, Rep Payee, DTA, Self-Help Inc., food pantries, charity organizations such as the church, the Salvation Army, My Brother's Keeper for furniture, bank financial advisors, and health imperatives. So we had a couple that, weren't in the list you came up with today. So, and I think you guys might have had a few that weren't in this list, so we'll be combining those all. Cape, we actually did a Cape list, because we are serving the Cape. Duffy is on the Cape, and New Bedford Town and Family is on the Cape. So the Cape, just really quickly, we came up with for social YMCA, Peer Recovery Center, Drop-In Coffee House, Day Shelter Program, Mental Health Clubhouses, RCC Clubhouse, and Dancing in the Rain. Addictions was MAT support through Duffy and Harbor Health Center, so medication assisted treatment, Methadone Clinic in Yarmouth, AANA Peer Recovery, Cape Cod Hospital, Gosnold and Falmouth, and High Point for detox.
There's also a program, VinFen. VinFen, that they, on the Cape, it's for mental health.
So you
And
wanna
they have
add
I know you.
Would that be under
social, but they have a clubhouse and it's, they do all that too. It's
So just add
MANS.
under social. Thank you. Professional, they came up with a Mass Rehab, Women's Support Group, We Can. Housing was Housing Assistance Corporation, housing authorities in each town, and St. Joseph's Shelter. Voc was Mass Rehab, Unemployment Office and Career Opportunities. Financial was DTA, SSA, Salvation Army, Lombard Fund Housing Assistance Corporation, St. Vincent de Paul, Needy Fund, Outreach Council, Hands of Hope, Fuel Assistance, Legal Assistance, Basic Needs, various organizations, and Salvation Army and Community Meals. We did do a Fall River list, which we're gonna just pass down for now, because we don't have any Fall River people here. New Bedford, we came up with PACA, Council, you guys did a really thorough job, so Council on Aging, Elderly Day Services, Active Day, Project Independence, Cape Way Elderly Services, YMCA, YWCA, social groups such as Anger Management and AA, PACT Center, South Coast LGBTQ Network, churches, 40+ Women's Group, Women's Center, Serenity Sister Support Group, the BedfordMass.gov website for community services such as parks, libraries, and Catholic social services. Vocational, UMass Dartmouth, Bristol Community College, New Bedford Voc, GED and Night, New Bedford Career Center, Lifestream, and temp agencies, Work Ready, East Coast Staffing, and PA Staffing. Nemusket Group, Community Connections Inc., Semcoa, and Gavin Foundation. I think there were a couple that you guys didn't list in that one. Professional Crisis Center, Greater New Bedford Health Center, South Coast Hospital Groups, Prime Care, Hawthorne Medical, The Bridge at St. Peter's Church in Dartmouth, Seven Hills, VNA, Gosnold and Lifestream, Legal Services, Police, Fire, Housekeeping, Employment. On housing, Greater New Bedford Housing Authority, American Red Cross, Catholic Social Services, DTA, WIC, PACE, VA, Salvation Army, HUD Housing, Housing Solutions of New Bedford, Sisters of Charity, Harmony House, and other shelters, My Brother's Keeper, Gifts to Give, Big Brother, Big Sister, the Immigrant Assistance Center, Food Banks, MCOA, New Bedford, Mass.gov, Street Sheet in all languages for current housing resources, Stepping Stone Welcome Home, CSPAC, and HSPN. Addictions, PACA, High Point, Seven Hills, Smart Recovery, Stepping Stone, Ad Care, Open Doors Recovery Center, Support Group, Clean Slate, WOTC, Healthcare Resources, Methadone Clinic, Gifford Street Wellness Center, Reflections, Wrap House, Anchor Medical Group Addiction Treatment Center, Treatment on Demand. And financial is DTA, PACE, Food Assistance, Social Security, WIC, Meals on Wheels, Food Pantry, Free Cell Phone, the ARC and ICC, Financial Assistance Program Repairs on Homes, and New Bedford website Coastline. And for Taunton, we came up with Taunton Library for social, Taunton Library, multicultural building, churches, LGBTQ groups, YMCA, local recreational sports, Pride Incorporated, Bethany House, Corner Club, Harmony House, Golden Years, Our Lady of Lourdes, Taunton Council on Aging, Bristol Elders, Planet Fitness, and Associates for Human Services. Vocational was Taunton School to Career, Youth Work / Career Works, Job Fairs, GED programs, Tech Schools, Mass Rehab, Taunton Career Center, BCC, Bristol Community, Adult Literacy Program, Pride Inc., and Military Recruiting. Housing was THA, Homeless Shelters, Subsidized Housing, Samaritan House Housing Solution, Home for Our Troops, Journey House, Bridge House, Robert Smith House, 1-800-HOMELESS, and Father Bills. And addictions are AANA, High Point, South Bay, Stepping Stone, We Care Inc., the Stevens Treatment Program, Northeast, CCBC, Volunteers of America, Taunton Comprehensive Treatment Center, New England Center for Psychiatric Addiction, Arbor Fuller, DRA groups in the area, and BAMZ Peer Recovery Support. Financial, welfare, SNAP, self-help, Inc., food pantries, Attleboro Enterprises, New Hope Inc., Citizens for Citizens, Bristol Elders, DTA, Social Security, PACE, St. Vincent de Paul, Salvation Army, Catholic Charities, Beta Community Partnerships, Taunton Area Community Table, and Professional Interview Prep Therapist Specialist, the PIN Program, Norton ESP, VNAs, EPIC, Nishoni, Maestro, Nightingale, Visiting Nurse, CCBC, Pathway State Program, DYS, Morton Hospital, Taunton State Hospital, New Hope, Lerner Cove, and Northeast Health Services. And I would add to that High Point home-based counseling program. And then Plymouth, addictions was Harbor House, High Point, Clean Slate, AA, Anchor House, Cameron House, PACA, and Crossroads, Social, Plymouth Council on Aging, Library, YMCA, Boys and Girls Club, gyms, Financial, DTA, WIC, Salvation Army, South Shore, Community Action Council, Food Pantry, South Shore Women's Resource Center, RAFT program. And housing was PHA, Winter Homeless Shelter, Bethesda House, Battered Women's Program, Habitat for Humanity, Home Base. Vocational was Career Center, Recruiting Office, Quincy College, Curry College. And professional was DMH, DCF, Bay State, Home Health Care Services, Plymouth Court, for Women's Advocate, BID Plymouth Hospital, Beata Home Health Care, and Able Home Care. So there was a few that you guys missed, a few overlaps, so we're gonna take these lists.
Sorry.
Yep, one more.
Independence House?
For the Cape?
For the Cape, yeah,
wanna
sorry,
go
I
up
just
to the
thought of
Cape.
them while you guys were
Yep, anything that you,
talking.
anything we can add.
Because Independence
Great.
House, they're gonna be eventually building an actual shelter for
I didn't think,
domestic
we had a
violence.
small Cape group, so
Yeah.
Independence House under,
Also, housing.
Under
Safe
housing.
Harbor, Safe Harbor, women's and children, Safe Harbor.
Yes.
It's in Hyannis.
okay.
And then there's, the two places, I mean, we didn't really talk much about people that have been incarcerated, but there's, Friends of Prisoners, which would take people from like Plymouth County.
Would that be under housing?
That would be under housing, yeah, sorry.
Friends of.
And addiction, so it's a sober house kind of too, so I mean, it's, I guess we do it under housing though. And St. Clair's will take people from actually New Bedford, the women from Bristol County, but they're on the Cape, so they take them from Barnstable and Bristol, so.
Great. So you guys do know a lot about your communities, so that's a great sign. And anything that you weren't aware of, like I said, we're already gonna have so many resources for you guys to go to right off the cuff with all the things that we're putting together. So we'll have lots of handouts for you, and I suggest you make some sort of an organizational system that goes, policies, resources, and if you want to put health and wellness issues, so under each category that we've done, you might want to have an organizational system for, and I definitely strongly recommend that we're going to give you all the policies, that you keep all the policies and their attachments in a binder. And we'll give you all the paper forms, even though it's all going to go into Care Navigator. For practice purposes, it's good to have the paper before you're actually trained in Care Navigator. So we're going to get you all those things next week. We are going to eat early today, so it should be being brought out if it hasn't already. Jessica, did they bring the food out? Can you just check? I know that they were going to bring it out. So we can take a break and the food's going to be brought out.